Medications for lupus. Hello fellow warriors, welcome to Lupus Tips with me, Susie Eaglesflight. This month's focus is on medications for lupus. Lupus, systemic lupus erythematosus or SLE, is a condition that results from a malfunctioning immune system. The main form of treatment for lupus is medication. Medication used to treat lupus includes non-steroidal anti-inflammatory drugs, NSAIDs, corticosteroids, chloroquine, and immunosuppressants. The type of lupus medication used and the prescribed dosage depends on factors like the severity of your condition and your symptoms. Chloroquine sulfate and other antimalarials. Chloroquine sulfate is also known as plasmaquine, and it is a type of antimalarial medication. Antimalarials work by reducing autoantibodies. Autoantibodies is protein in the blood that attack healthy cells and tissues. Doctors use antimalarials to treat malaria, but these medicines can also be used to treat lupus by reducing pain and inflammation, preventing lupus flares, and helping with lupus skin problems, lowering the dose amount you need to take of your other lupus medication. Most people with lupus take chloroquine throughout their lives. It helps control lupus symptoms with very few side effects. Chloroquine may also help prevent blood clots and organ damage from lupus. It usually takes 1 to 3 months to start working. Types of antimalarials. Chloroquine sulfate plasmaquine is the most common antimalaria for lupus. If you can't take chloroquine sulfate, your doctor may recommend other derivatives of chloroquine. These medicines can be taken as a pill or as liquid. Side effects of antimalarials. Most people don't notice any side effects, but antimalarials sometimes cause stomach pain and digestive problems like nausea and diarrhea. These side effects usually go away once your body adjusts to the medicine. In rare cases, taking high dose of antimalarials or taking them for a long time, it may damage your eyes. If you're taking antimalarials, ask your doctor about getting regular eye exams to make sure your eyes are healthy to monitor any changes. Steroids. Steroids can help reduce the pain and inflammation. They work by decreasing the activity of the overactive white blood cell. This prevents them from causing inflammation that leads to lupus symptoms. You may hear other words for steroid medicines like corticosteroids, glucocorticosteroids, and cortisone. Steroids you take for lupus are different from the steroids that some athletes take to improve their performance. Those are called anabolic steroids. Types of steroids. We have prednisone, which is the most common one. And if you have liver problems, your doctor may recommend different steroids called prednisolone or methylprednisolone, which is Medrol. There are a few different ways to take steroids. Most people take steroids in pills. If you take steroid pills or you're having severe lupus symptoms, your doctor may give you steroid injections, also called pulse steroids, and the name is Depomedrol. If you have skin lupus, your doctor may recommend steroid skin creams or gels, which can treat lupus skin problems with fewer side effects. Side effects of steroids. Steroids can cause a range of effects, including swelling, weight gain, problems sleeping. If you take steroids for a long time, they can also raise your risk of other health problems like infection, osteoporosis, which is weaker bones, and diabetes. Non-steroidal anti-inflammatories, NSAIDs, which is non-steroidal anti-inflammatory drugs. NSAIDs can also reduce pain and inflammation, but they are not steroids. They work by reducing chemicals in the body that cause inflammation, usually acid. NSAID usually start working within a few days. They're the most common treatment for typical lupus symptoms like fever and joint pain. The types of NSAIDs, which is ibuprofen, which is brufen, naproxen, which is naproxen, indomethacin, which is indocin, nebumetone, which is Relifen, and celecoxib, which is called Celebrex. Aspirin. In addition to treating pain and inflammation, aspirin can help prevent blood clots. Many people with lupus take a daily low dose of aspirin, also called cardiac aspirin, and I think it's 81 milligrams, to lower the risk of blood clots. What about paracetamol and acetaminophen? Paracetamol, Panado, or Tylenol acetaminophen is an over-the-counter medicine that can help ease pain and lower fever, but it's not an NSAID. It doesn't treat inflammation or any other lupus symptoms. Side effects of NSAIDs. It can cause problems with the digestive symptoms like stomach pains and ulcers because it is acidic. taking NSAIDs with food can help prevent stomach pain. Your doctor may also recommend medicine to help with digestion side effects like over-the-counter antacids like statins. Regular use of NSAIDs can also damage your kidneys. If you have kidney problems from lupus, talk to your doctor about ways to treat inflammation without using NSAIDs. Immunosuppressives. Immunosuppressives can help stop immune system from attacking your body's healthy tissue. Your doctor may recommend immunosuppressants if you're having a serious lupus symptom that affect your organs like your brain, kidneys, heart, or lungs. Types of immunosuppressants. The most common immunosuppressives for lupus include methotrexate, mycophenolate mofetil, which is Cellcept, azathioprine, which is Imuran, and cyclophosphamide, which is cytoxin. Each of these immunosuppressant medicine works differently and treats different lupus symptoms. Your doctor will help you decide if your treatment plan should include immunosuppressant medicine. Blood thinners. Blood thinners, also called anticoagulants, can help prevent blood clots. If you have had blood clots on or you have antiphospholipid antibodies, your doctor may recommend blood thinners to lower your risk of clot. Types of blood thinners. Common blood thinners for lupus include heparin injection, warfarin pills, or low dose of aspirin. Side effects of blood thinners. Blood thinners can cause bleeding that is difficult to control. Get medical help right away if you notice these symptoms. Bleeding more than usual from a cut, very heavy bleeding during a period, red or brown colored urine, blood in the toilet after a bowel movement or dark black color of bowel movements, vomiting or cough up blood, feeling dizzy or weak. If you're taking warfarin, you may need regular blood tests to make sure that your blood doesn't get too thin. Monoclonal antibodies, mAbs. A monoclonal antibody is a type of protein made in a laboratory that is developed to find and attach to only one type of substance in your body. In lupus, it's the B-less protein. There are many kinds of monoclonal antibodies and they can be used to treat a number of diseases. There are two types of monoclonal antibodies approved to treat specific just lupus. It was developed specifically just for lupus, which is Safnello and Benlysta. Rituximab is also a monoclonal antibody, but it's approved to treat other autoimmune diseases as well. Types of monoclonal antibodies is belimumab, Benlysta, afrolumab, Fenia, Safnello, rituximab, which is Mabthera. All of the above are biologics too, but not all biologics is monoclonal antibodies. Sometimes biologic and monoclonal antibodies are also called immunosuppressant because they do suppress the immune system. Side effects of monoclonal antibodies. Each type of monoclonal antibody can have different side effects. They can include nausea, diarrhea, fever, trouble sleeping, pain in the arms and legs, migraine, headaches, depression, increased risk of infection, and increased risk of shingle. Then we get to biologics. Biologics are a class of medications derived from living organisms such as bacteria, viruses, or human cells. They are typically proteins, antibodies, or other complex molecules that are produced using biotechnology techniques. Biologics are used to treat a wide range of conditions. For example, autoimmune diseases like rheumatoid arthritis, lupus, and psoriasis, inflammatory diseases like Crohn's and ulcerative colitis, cancer, infectious diseases like HIV and hepatitis C. Unlike traditional medications, which are often chemically synthesized, biologics are produced using biological processes. This can make them more complex and expensive to manufacture, but it also allows for the development of highly targeted and effective therapies. Some common examples of biologics include tumor necrosis factor TFN inhibitors, for example, Humira, adalimumab, used to treat rheumatoid arthritis, psoriatic arthritis, Achilles spondylitis, juvenile idiopathic arthritis. Then we get Enbrel, which is a etanercept, used to treat arthritis, psoriatic arthritis, and Achilles spondylitis. Infliximab, which is Remicade, used to treat rheumatoid arthritis, Achilles spondylitis, and Crohn's disease. Other biologics. Rituximab, used to treat rheumatoid arthritis and other autoimmune diseases. Doctors will usually use it to treat lupus with kidney problems too. Tocilizumab, used to treat rheumatoid arthritis and juvenile idiopathic arthritis. anakinra, used to treat rheumatoid arthritis. Abatacept, used to treat rheumatoid arthritis. Isticimab, used to treat psoriasis. Tofacitinib, used to treat rheumatoid arthritis. Remember, a lot of biologics these days are used to treat lupus, although they're not specifically developed to treat lupus. Side effects of biologics. It's important to note that biologics can have potential side effects such as infections, allergic reactions, increased risk for certain cancers. Biologics should only be used under the guidance of a healthcare professional. However, biologic is noted to have less side effects than all the other lupus medication. In conclusion, there are different kinds of medications for lupus. Your doctor puts together a treatment plan for specifically you, and it will depend on your lupus symptoms. There are antimalarials, NSAIDs, steroids, immunosuppressants, bloodthinners, monoclonal antibodies, and biologics. Other medications that are not included above are antidepressant, sleep aids, and supplements. Work with your doctor on your treatment plan and be your own advocate. This concludes this episode. If you enjoyed this video, please hit the like button below. Follow us on Facebook, Instagram, TikTok, and subscribe to our YouTube channel. Thank you for watching, and remember, giving up is not an option. Bye.